Good afternoon, respected General Secretary, ILTA, respected Speaker, Dr. Dipanjan Majumder, Mr. Shubho, Mr. Samrat, on behalf of Narayana Group, one of the leading group in the healthcare sector, and also as a partner, healthcare partner of ILTA, and my respected audience. Today, our association is pleased to announce that this association starts its journey to healthcare and awareness program as part of raise awareness among the fraternity in particular and general public on the whole. This speech will be delivered on oncology. Your support and cooperation will give us strength and will also embolden us to conduct such program in future. With this, I conclude my brief message and request my secretary to open the program. Thank you.
Thank you, Mr. Chaudhary. Good afternoon. Today we are here to listen Dr. Dipanjan Majumder to enhance our awareness on prevention of the deadly disease cancer. Last year, as per the data, around 14 lakh people infected with cancer in India. And it is estimated to increase every year by at least 1 lakh patients of cancer in India if we don't take proper measures and increase the awareness among people immediately through our association or through our government. We lose around 10 lakh people every year due to this critical disease. And the survey says 40% of the cancer cases in India are due to tobacco. And it is also says that India could be the cancer capital of the world in near future. Survey also says that this 10 lakh people every year we lose, that is mainly due to lack of awareness and social stigma, and a huge number of cancer cases are detected at late. So if we can detect the cancer patients in early, then we could save a huge number of people. So proper initiatives on these two factors, that is lack of awareness and detection in time, could reduce number of cancer patients and number of deaths remarkably. ILTA wishes to work in this direction, and to start with, we have organized this medical talk to educate people on prevention of cancer. By saying this, I, on behalf of ILTA, GCELT and Alumni Association, welcome you all and expressing our thanks to all the participants to attend this event. Thanks to Dr. Dipanjan Majumder for agreeing to deliver today on his very important topic, and to Mr. Chaudhary, the coordinator HR committee, Mr. Samrat Pal on behalf of Narayana Group, Alumni Association, and Dr. Sanjay Chakraborty, Principal GCLT, for taking all these initiatives and cooperating with us in organizing this event. Jointly with Narayana Group, we are going to organize series of events on healthcare. I will announce one by one in the months to come. With this, I request Mr. Samrat Pal to say few words on Narayana Group and to introduce our honorable speaker to the participants before commencement of his lecture. Thank you very much.
Thank you. Good afternoon, all. Good afternoon, all of you. As you know, that Narayana Group is catering their services across India, and we have 4 units and 2 clinics in Kolkata cluster. And ILTA, I'm very glad to say, and it's my privilege to get ILTA and getting their services as a medical partner to them. And thank you so much to all the members of ILTA for giving us this chance and trusting on NH, on Narayana Health. So today I would like to thank Dr. Majumdar to agree for this participation. I would like to thank uh, to all the members of ILTA and Mr. Shoikot Raut, our digital support for this event, Mr. Shubho Paul, Mr. Amur Jadov. Without them, their support, it cannot be done. So without wasting any time, I would like to move ahead. That we have speaker as a speaker, Dr. Dipanjan Majumdar. He is one of the best radiation oncologists in Calcutta. He is an expert in IMRT, IGRT, SRS, and 4 DRT procedures. His major area of interest is head and neck oncology and RT using motion management, and he has performed hundreds of stereotactic radiation procedures with excellent outcomes. He has performed thousands of IMRT and IGRT procedures. Dr. Dipanjan Majumdar is a well-known member of the Association of Radiation Oncologists of India, Indian Association of Palliative Care, and European Society for Medical Oncology. Some of the treatment offered by Dr. Dipanjan Majumdar are scan and stereotactic surgeries. So I would I would like to request Dr. Majumdar to please take over the session and to please move ahead. Thank you so much. Over to you, sir, Dr. Majumdar.
Yeah, hello, thank you everybody, and thank you ILTA for giving me this opportunity to speak in this forum. Now, let me start. So it has been told to me that I have to speak about the cancer, some information about cancer, and also how we can prevent the cancer and how we should approach this disease. If somebody is getting diagnosed with this particular disease, what should be our approach so that we can handle this specific or deadly disease? First of all, a very basic idea about cancer. Whenever we are listening to this particular disease, everybody should know what is cancer. Why this is important? Because we know about heart disease, we know about brain stroke, we know about diabetes, cholesterol or hyperlipidemia, this type of disease. We have heard about that. So if somebody is saying that I have diabetes, everybody can understand, yes, he has got some problem, or here his blood, his or her blood sugar might be high for a prolonged period, this and that. But if anybody is saying that the patient is suffering from cancer, then there is a type of a misinformation, or rather people don't understand what exactly this disease is. And this is very important. If somebody is getting this particular disease, any of your neighbors or any of your relatives, anybody. So first, only thing is that cancer is a disease which is going to kill. That is the common notion which has been propagated amongst the people, and for definite reasons. I am not saying that their reasons are not reasons are absolutely wrong, because this disease is difficult to control, and there is a very high mortality rate. But the thing is, the important thing is not only cancer. There are many non-malignant disease which has got a higher mortality rate than cancer. Still, we do not have heard of that disease, or we do not be very scared if somebody is saying this type of disease has been diagnosed. But in case of the cancer, it is not like that. And some of the cancers are very low-grade cancer. Even if we are going to say that patient, any patient that you have got this cancer, patient will be type of afraid that probably that might be the end of his life or something like that. So that is why the concept of cancer has to be very clear. After the concept of the cancer, what other information any particular patient, if have diagnosed with the cancer, what other information is important? Like some specific questions usually asked by the patient's relative, like how the cancer has been diagnosed, what are the risk factors of the cancer, what does the cancer stage actually mean, or cancer can be prevented or not? Now, let me first try to give the answer of the first question, that what is cancer? Now, if you can appreciate that from the in this specific cartoon, we can see one orange cell on the top. Can it be visible, that orange cell? Hello?
Hello?
Yes.
Yes,
Sir,
Madhu.
absolutely, Madhu.
Yes, sir. Yes, sir.
Okay, fine. So if
Absolutely.
we can follow the two pathways of cell division. One is in the right side, we can see that from one orange cell, there will be the two orange cells. From the two, there will be four orange cells like that. But if in case of the left side, we can see that from one orange cell, there will be initially two or three green looking cells, then there will be the innumerable green looking cells are formed. Now there is two specific differences in this pathway. One is, if you can follow the orange cell pathway, you can see that the cell, whenever it get divided, it actually looks same as the precursor cell. But in case of the green cells, you can clearly appreciate that the structure or the shape of the cell is distorted and numbers is also uncontrolled. So that is the pathway. This pathway is called a cancerous development of a cell, or cancerous tumor development in the body. Now, normal cell usually grow in a normal pattern. That is how whenever a child is born and he or she will get mature, then all the organs will get matured by the function and the structure and the shape and everything. But the cancerous cell will not follow any basic rules of the cell division. So there will be a complete lawlessness in case of the cell division. That is called cancer, and that is why this disease is very important. Because if we have got some non-cancerous tumor or benign tumor, probably there will be a little bit of extra growth of some cell, but the control of cell growth or control of cell cycle will not be lost. That is why there will be a certain extra cell development, but that will never be uncontrollable. But in case of the cancer, it is almost uncontrolled cell death, so cell division. That is why we have to give various type of treatment to treat cancer, and that is why the stage and everything is very important in this particular disease. Now, you can appreciate that the cancer cell, not only it will divide innumerably, but also if you can appreciate the structure of the cancer cell, it has been depicted on a electron microscopic view, that there are a lot of stellate-like cells, stellate-like structures radiating out of the cell wall or cell outer surface of the particular cell. So this is actually, that is also a property of a cancer cell. So property of a cancer cell means whenever the cancer cell will, so first of all, there is an uncontrolled growth. If some cancer cell has been developed in a rectum or in any part of in breast or any part of the body, initially there will be a tumor. But as this is uncontrollable, so the tumor growth will not stop. So after a certain period of time, the number of cells will be so high that these cells will actually travel through the bloodstream or through the lymph glands to different part of the body to get deposited in different part of the body. And then the breast cancer cell will be deposited in the liver, and there will be a secondary deposit of a metastatic disease in the liver. So that is how the cancer actually spread in the body. And that is why the stage is very important. So roughly the cancer stage means if a tumor is locally placed, that means the breast tumor is only in the breast. That is a very limited stage of cancer. If this has spread to some surrounding area, like in the breast cancer, the tumor has spread to the surrounding organ, means the axilla, that means the armpit, or nape of the neck, or that is the supraclavicular area. Then we can say that it has spread, but to the limited area. So that will be called as a loco-regional disease. But once it has spread it to the distant organs, like the liver, like the brain, any other part of the body, then it will be called as a stage 4 cancerous tumor. So that is how the stage of the cancer roughly means. There are a lot of nuances in between, but the roughly that is the stage. So localized disease mostly the stage 1, local regional disease mostly stage 2 and stage 3, and distant spread to different organs, then it will be a stage 4 disease. So as it has been clearly mentioned also before starting off my talk, that the tobacco is the main killer of the cancer, and mostly the 40% of the Indian world cancer population will be having the tobacco usage in their in their habit or whatever, in their addiction form, like that. So that not only tobacco, if somebody is having some cigarettes, so not only the tobacco, even the foil which is used to cover the tobacco, the filter itself, and there are a lot of other carbonated particles inside that will equally be a carcinogen. So carcinogen means the specific substance which can cause cancer. So the tobacco, the cigarette will have all form of carcinogens, and not only the cigarettes, any form of tobacco like the panj or the gutkha, anything will be associated with sort of the cancer. And the diet. Diet is not as strong as the tobacco, but still there are some dietary modification has been advised from some sparse literature that we should actually avoid the junk foods, the high temperature cooked foods, the food with preservatives, and the frequent intake of the red meat, like that. So this actually we can avoid if it is possible. That will help in a way that our cells will be little bit of more pliable or more fit. We can be more fit in our older phase of the life also. And some sort of the studies in the Japan and this thing, it has been shown that the high cooked meat and fish and this type of food, actually there is a association of development of the gastric cancer, but this association is not as strong like the tobacco. So we still not saying that completely avoid this type of food, but preferably try to restrict these things, and the tobacco, a complete avoidance to that is advisable. And another important thing is not only the food and tobacco and this thing, even the lifestyle is also can cause some can be a causative factors of the cancer, like the obesity, lack of exercise, and the stress. Actually, these particular 3 things everybody are going through this phase of life, and this phase of life is very new to us, because in the last 3 to 4 decades back, or not only 3 to 4, 2 to 3 decades back also, this was not a big problem. But right now most of the jobs are table jobs, and most of the jobs will be done sitting on the table inside a AC room, and there is absolutely no physical activity. Mostly people are traveling by some sort of vehicles, and there is the cycling and everything people used to use in the previous days is presently almost out of the way in many cities, like that. So city style life is actually very sort of it is a type of a concern in terms of the development of the cancer, because this is a triad. Lack of exercise will cause obesity, and that will cause stress, and stress will cause again lack of exercise. So this is actually a cycle. So this cycle actually cause some sort of the hormonal changes in the female body, and not only female body, in the male bodies also, that might be a causative factors in development of the cancer. I'm not saying everybody doing like that will develop cancer, but there is a risk factor. The risk factor is definitely there. And the environmental pollution, we cannot avoid. Environmental pollution is actually increasing, so we cannot avoid. So that is type of unmodifiable cause of the cancer. We preferably, if it is possible to get the environmental pollution under control, it will be fine. But unfortunately, probably this is too much optimistic to say like that. Still, we have to handle that. But whatever the modifiable cause, we should try to minimize those things. Then the radiation itself has everybody knows that the atomic explosion in the Japan and their subsequent generations, and they have faced some sort of the changes in their bodies in terms of the malformation, in terms of the premature development, premature delivery, and a lot of the things that happened. And from these subsequent generations, actually the radiation related toxicity was studied, and radiation itself, a very high dose of radiation or Even persistent low dose of radiation can cause some sort of the secondary malignancies. That is also a causative factor. Now, cancer in India, actually more than 10 lakh of cancer per year, it has been diagnosed. And almost 60 to 70,000 of the death is caused by the cancer. So if you can see that what are the common cancers in India? In female, first two cancers are breast and cervix cancer. And in male, mostly head and neck, commonly oral cavity, and then lung cancer or fuspusher cancer, lung cancer. Now I will first give a brief idea of the female cancers, because it is very interesting to note that though these two cancers are very important or very much prevalent in female population, but you will be delighted to know that these two cancers, you have definitely heard that this particular phrase, that your cancer is curable if it is diagnosed early. And whatever form of treatment modification or the advancement in our treatment delivery system being developed, still the phrase will always be the same, because as long as whatever the treatment advancement we will do, we cannot compare the stage 1 cancer with the stage 4 cancer. So if stage 1 cancer, we can have a 100 stage 1 cancer, we can treat, or we can cure 95 stage 1 cancer. With the advancement of the treatment, probably we will treat 95 to 97. And in stage 4 cancer, if it is among 100, we can actually in the stage 4, most of the cancer is not curable. So if the survival, we can increase up to 5 months. With our previous treatment modality, with the advancement of the treatment modality, we can actually extend it up to 2 years or 2.5 years, like that. But a stage 1 cancer can never be comparable to stage 4 cancer, mostly whatever form of the treatment advancement will be there. So that is why the stages are very important. And you will be delighted to know that the breast and cervix cancer, these are most common female cancer in our country. And both these cancer actually can be detected very early stage. So if some cancer cannot be detected in the early stage, what people can do, because there are some carcinomas which cannot be detected in the early stage, and they will come to the OPDs in the very late stage, and nothing much we can do. But in case of the breast and cervix cancer, if people can be a little bit of aware about these two cancers, they can actually be diagnosed in a very early stage, and sometimes even before stage 1 also. So that is called a screen detected cancer. So what are those? I'll just give a brief idea about that. So breast cancer is a common cancer above the 40 years of age. Mostly it has been seen in the 50 to 65 years of age group, and it is a number 1 in terms of the cancer occurrence and in the cancer death also. So more than 1.5 lakhs a year. Now, the important stat is in urban population, 1 out of 22 women will have a breast cancer, whereas in the rural population, 1 out of 60. So this is mainly a urban population disease. So why? Because in urban population, there are some certain lifestyle of amongst the female, which can actually act as a precursor of the breast cancer. What are those lifestyle factors? First of all, this obesity, lack of exercise, and this triad will be definitely one factor. But beyond that also, hyper exposure of a specific female hormone, that is called the estrogen, that will actually be a risk factor of a breast cancer. So how this particular hyper exposure of this particular hormone will be there? So there are some specific female condition by which this can be possible. One is early menarche. That means the period starts earlier than usual period. Late menopause. That means the menopause, the stoppage of the periodic blood loss will be delayed compared to the usual time period. Nulliparity. That means the patient don't have any kids. Late marriage. Lack of breastfeeding. These are all type of risk factors, which is common to the urban population, because the type of life, the lifestyle in the urban group of female will actually a precursor of this type of thing. And rural area, it is less, because this type of problem, this type of thing, we generally do not see in the rural area common. And there are definitely some other genetic factors, because the breast carcinoma has got some genetic association also. So you might have heard about the BRCA1, BRCA2 mutation and this and that. So these are some genetic conditions. But other thing is the early menstrual period, late or no pregnancy. This thing I have already explained. So, but if somebody is suffering from breast cancer, what can they do? First of all, people should be aware about the changes in the breast. So you can see here, there are some lump or tumor type of thing. There is some skin changes. There are some changes in the nipple areola complex, we usually say. And there is a thickening of the skin, something like that. Or any indentation. That means any tumor, any discharge, any blood coming from the any part of the breast, everything. If this type of thing happens, people should not ignore. Usually blood and blood coming from the breast tissue or some massive skin change, people usually don't ignore. But people usually cannot understand initial small lumps in the breast, because the lump cannot be always evaluated. Because breast is in the breast tissue, a lump, something is sometimes very difficult to appreciate the presence of lump also. That is why it has been advised that a self breast examination can be one important tool to assess the breast. How it is possible? So it has been advised to any women, age older, that should palpate her breast at least a month. Palpate means to check at least once a month. Preferably the same day of each month. Now, this is the way they should check the breast. They should use the palmar surface of the finger. That means the ventral surface of the finger, this portion of the finger, and loosely check the breast in this fashion. That is up and down, that is wedge fashion, that is circular fashion, like that. And if any lumpiness or tumor type of thing or any lump type of thing is there, they should keep a note on that. Now, very important to know that if somebody is saying, yo, okay, I have done my breast examination and I have found some lump in my breast, and they get panic, and they will go to the doctor and they say, I have been diagnosed with a cancer because I have seen my breast and I have found a lump. So there is nothing to worry about, because sometimes there will be a presence of lump which is very normal. That the glandular tissue, sometimes the glands will be feeling like a lump. That is a normal physiological process. Sometimes a lump will be palpated, but the diagnosis will be fibroadenoma. So fibroadenoma is the most common breast tumor. So even if the breast lump is being palpated by any women, most of the tumor will be fibroadenoma, and fibroadenoma mostly will not require any treatment. But even if one or two patients will have cancer in that group, then they should be treated, because most of the time they will be in a stage 1 mostly. If she will be very unfortunate, that can be a stage 2, but mostly that will be a stage 1. Now, this is a cell breast examination. Another thing is mammogram. So mammogram is a test which is advised after 45 years of age of a female. So annual mammography is actually important, because mammography is a particular test by which even a breast lump can be seen prior to the clinical appreciation of a breast lump. That means if there is a breast lump and it has got some suspicion of a malignant disease, but nothing can be palpated over the breast region. So mammography can detect this thing even prior to the palpation. So that means mammography detected breast carcinoma can be mostly even before the stage 1. So that means it is almost 100% curable in most of the cases. So that is why the mammography is advised on an annual basis in an older group of women. Because before 45 years of age, actually mammography is not advisable, and mammography will not give you much information about that. Treatment of breast cancer carcinoma, mostly surgery, chemotherapy, radiation therapy, hormone therapy, target therapy. I am not going in detail about the treatment. I will just give a brief idea about the all cancer sort of the treatment, so that some idea will be there. Now, second cancer is the cervical cancer. Again, cervical cancer also present with a pervaginal bleeding. So, people usually, the problem in case of the in treatment of cervical carcinoma is sometimes women have the pervaginal bleeding, but they are shy that they will not go to the doctor to tell this type of thing. Even not only the doctor, they will not even tell this to their family members also. And when this bleeding is very serious and she starts to get anemic, and there will be a lot of medical complication, then usually people will take this patient to the hospitals, and then on examination the cervical carcinoma has been diagnosed. And mostly the cervical carcinoma is a rural disease, because there are some sort of the hygiene relation with this particular carcinoma, and where there is a overcrowded place, the people are living in the chawls or bastis like that. So in that case, there will be overcrowding, and the hygiene might not be in a proper way. In that case, or in those group of female, the chances of the cervical cancer is higher. Now there is almost 1.34 lakh of cancer and 70,000 death of cervical cancer. So this is also a high number, and the cervical cancer rank 2, not in rank 1. So it is rank 2 among the cancers in female in India. Now, the important thing about the cervical cancer is the human papilloma virus vaccination, or human papilloma virus. This particular virus is a sexually transmitted virus, and some of the strains of this virus actually cause changes in the cervical mucosa. Cervix means the lower portion of the uterus. So lower portion of the uterus, you can go through my previous slide. So this is uterus actually, and this portion is called cervix, and you can appreciate this is called cervical cancer. So when there will be a cervical cancer, there will be bleeding, and bleeding will be directly going through the vaginal route to the outside, and present as a pervaginal bleeding. Now, HPV, some strain of the HPV will changes the cervical mucosa in that way that the cancer will be developed. So, who are at the higher risk of the getting HPV virus? So, first, the women who have multiple sexual partner, because before attaining the sexual maturity, HPV is unlikely, because HPV can only be infested after sexual intercourse. So women who have a multiple partner, they have got a high risk of getting this particular virus. And also some immunosuppressant medications like the steroid medication, transplant organ, patient on chemotherapy, HIV, this type of thing also can be a precursor cause of HPV infestations. Now, cervical cancer symptoms. The symptoms are bleeding after intercourse, mostly are bleeding per vagina, bleeding after menopause even, and in an advanced stage, there will be the pelvic pain, back pain will also be possible. Now, like the breast cancer, again, we can detect the cervical cancer very early. First of all, we have to do the pap smear test. So if we can do the pap smear test in a female after 20 years of age, we can identify some sort of the abnormal cells even before the development of the cancerous cell. So if we can detect the abnormal cells prior, we can actually put those patients in a close surveillance, so that if any cancerous cell has been developed, we can immediately treat them. Again, this type of method, we can actually detect the patient in a very early stage. So this is the way the pap smear has been done. Now, mostly after 21 years, pap smear has to be done. On a 3-yearly basis, pap smear can be done in a woman. Now, why I was telling about cancer there, in case of mostly more cases get a complete cure of the disease. Stage 2, it will be around 80%. Stage 3, it will be around 50 to 60%. And stage 4A, it will be around almost 15%. And from this stage 1 to stage 4, it will take hardly 1 year. So a patient, if presented in the OPD in a date where has got a cervical cancer stage 1, probably he will be cured. She will be cured. But after the delay, and there will be some sort of the changes in mind of which hospital, somebody in advising the people didn't no biopsy will be should be done, or they will wait for 3 months, then do the biopsy, then cancer came, then they will again decide themselves which hospital take, and they have to go outside of the state to go to different hospital like that. So this type of thing happens to the patients, and we have seen a lot of patients who, if they have started the treatment at the onset of the symptoms, probably they will be having a very earlier stage disease, like the stage 1 or stage 2. But when they come to our hospital or to the doctors in different hospitals, after going different hospitals in different states, receiving some there and some treatment like that, and they land up with. So whatever equipment, whatever the best medicine, whatever the best hospital in the world, they cannot give you a result in a stage 4 tumor who is more than 2020. So stage 1 is always better than the stage 4, whatever the form of best treatment modality you have. Now the vaccination. So HPV vaccination can be given after to eradicate the HPV cervical cancer, to eradicate the strains which is going to cause the cervical cancer. Initially, 2 doses has been advisable around 9 to 11 of age in the female, but can be after 20 up to 27 years. But most after 30 years, there is no role. Mostly after 20 years or 30 years, role is debatable, and mostly there is no role. Now, a proper diet. What should be a proper diet? It is preferable to have balanced diet, which is mostly possible for many of us. What is balanced? Like, be equal based, preferably 4 times diet is acceptable if somebody is going to plan their diet, and lot of vegetables and lot of fruits to be included in the diet, and the red meat and dried, fried, or this type of food, or fast food or junk food, this type of food should be avoided or should be minimized as much as possible. This is the proper, this should be a plan of any individual remain healthy throughout the. This part I have covered most of the female carcinomas, little bit about the male carcinomas also. So male carcinomas are mostly, if the tobacco usage will be eradicated, then the male carcinoma will drastically, the number of male carcinoma will be decreasing in our future. But not possible, because a lot of people are still using tobacco in a large extent, and that is why the lung cancer and the head and neck cancer are still very prevalent in our country. Head and neck cancer, if you have got some sort of specific symptom, the very hoarseness of voice, not coming, or ulcer in oral cavity, not healing with the conventional medications and this and that, you should be evaluated by a surgeon or by an surgeon. If there is any biopsy has to be done, biopsy can be done, and there is nothing to be worried about biopsy, because biopsy is the only thing which will give you a diagnosis, whichever diagnosis it is. It might be a cancer, it might not, but the biopsy is the final thing by which we can get this diagnosis. And but the head neck cancer, still we can have a type of early head neck cancer, but the early is very difficult, because lung cancer, lung is a huge, and if the tumor is growing inside the lung, it is very difficult to get symptoms early, because lung cancer usually at the very early stage will not give you any symptoms. So still getting rid of any habit of tobacco usage is the key point here to reduce the lung cancer. and lung cancer and overall the treatment. So mostly the cancer treatment, treatment in case of the cancer disease are the systemic therapy in form of the chemotherapy, targeted therapy, biotherapy, hormonal therapy, like that. And in terms of the radiotherapy and in terms of the surgery. So in all these three fields, there are tremendous improvement in the last 2 to 3 decades. Initially, the surgeon could not operate in a very deep-seated tumor. Right now, the provisions, the surgical instruments have been improved. There is advent of a surgery nowadays by which surgeons can operate a very difficult surgery. In radiation, a lot of improvement. Initially, the radiation means radiation therapy has to be given in the whole organ to treat a tumor. But right now we are actually moving in such a advanced technology that we can treat the tumor as per their motion, like the lung tumor. Lung tumor is continuously moving, and our machine is designed in such a way that we can actually track the tumor motion and we can treat this thing. So from the whole organ treatment to a motion directed treatment. So there is a huge of advancement. In terms of the chemotherapy system also, there are a lot of newer models have come. That is why we can fight better with this particular disease. But we have to fight. We have to fight very hard. Thank you for your patience, and if you have happy to answer, or it will be easier for me to at least 2 to 3 questions from your side.
Thank you, sir. I would like to request Shoikot to make sir visible to others so that they can see our Dr. Majumdar.
Okay. Shoikat is right now.
Yeah,
Oh.
so hello.
Yes, sir. It's a request from ILTA that they want to see you. So
Okay,
if you can.
Okay, I am trying to open the video. There is a problem because not actually. It is not possible from my side. Is it possible from the host side to uncheck video or to open this video? Because from my side it is not possible.
Connect করতে পারছি না problem. Oh, আচ্ছা, okay. আমাদের দিন আমাদের স্লাইডটা নিয়ে আসুন।
So, can you disconnect the screen share, please?
Okay.
আপনি বেরিয়ে যান তাহলে।
একটা screen share করছি।
আপনার স্ক্রিনটা ব্যাক করুন, ওটাই করলেই হবে। আগে আমাদের স্ক্রিনটা আনুন।
করা আছে তো, এই যে উনি না বেরোলে এটা হচ্ছে এইবার হচ্ছে।
Oh, thank you, Dr. Majumdar, for your highly informative and educative deliberation. Unfortunately, our participant is not that much high, and I think it is due to the timing of the webinar. That is our mistake. I should have organized a little later. We could have got much more participants because we got initial response was very good. Anyway, may I ask our participants to ask any question if they have for Dr. Dipanjan Majumdar. So you can unmute yourself and ask the question.
Hi, good afternoon, Dr. Majumder. My name is. So, just a question to you: that is the data about this? How much percentage of these lung cancer patient are the smoker, and how much percentage is non-smoker? Because in my periphery, I have seen 3-4 cases who have the lung cancer, and every time it is there that it is in the last stage, initial stage. There is no symptoms, not at all, no sort of pain like that, and these people are non-smokers. Is data that what is the percentage of smoker cancer and non-smoker?
See, the thing is, the question what you have asked is a very good question, really. But the problem is the lung cancer is a very broad term. Okay. Now, there are the most common type of the lung cancer we are encountering, or we encounter two types two types of the lung cancer we usually encounter. One is the squamous cell carcinoma, another is the non-squamous cell carcinoma. And another is the small cell carcinoma. Sorry, small cell and non-small cell. And in non-small cell carcinoma, we usually got two types commonly. One is the adenocarcinoma, another is the non-squamous cell carcinoma.
Okay.
Now, the thing is, squamous cell carcinoma and the small cell carcinoma are mostly linked with the tobacco smoking.
Okay.
Okay. And the adenocarcinoma are mostly linked with tobacco user. Or this particular carcinoma usually occurs in case of the never smokers. Fine.
Okay. Passive.
So passive, you cannot say about passive also, because the thing is that in case of the adenocarcinoma, there are a lot of molecular paths to be studied. Like when there is an adenocarcinoma cases, we usually do the EFR, mate function, and also the PDL1 and this type of molecule do. And that the they are mutated disease, and they will be actually benefited from a targeted therapy that is called the gefitinib or allotinib, whatever these things are. So this is a EGFR targeted therapy. The thing is that there are some specific group of lung carcinoma which got a direct link with the smoking, which is called the squamous cell carcinoma, and small cell carcinoma also 80 to 90% will be related to the smoking. The small number of small cell carcinoma is not that high, but the non-small cell carcinoma are more to the small cell, and in the non-small cell, squamous is mostly linked with the sort of the smoking. Now, whatever your question is, you have said that you have seen the lot of patients, they are never smoker, but they have diagnosed with the lung cancer, they have died, and it is possible because the most of the time carcinomas are not smoking related; they are completely sporadic, and that is why we cannot decrease the number of occurrence of the adenocarcinoma, even if we can eradicate the habit of smoking. But what the squamous cell carcinoma is also very higher in our society, and we can actually cut down the number of the squamous cell carcinomas. And the adenocarcinomas have a better prognosis than the squamous cell carcinoma, because adenocarcinoma mostly have a tumor targets, or mostly have a actionable gene mutation by which we can actually give some targeted therapy, and we can prolong the life of a patient with adenocarcinoma. Some of the patients at least 3 years getting that is the adenocarcinoma, which is almost impossible in case of the squamous or the small cell carcinoma.
Okay, thank you. And another thing, you were mentioning about the equipments, the machineries for operation, because it is normally we people always understand that there is a tumor and which is and doctors always prefer not to go for operation because this touches of metal or something like that, operative equipments start spreading it much faster than normal one. So is what case, or is it the myth, or is it the actual case?
I don't know from where the concept came, but this type of concept in between the sometimes patients say like that, but I really don't know from where this came. First of all, there is a cancer. Cancer is not a same disease.
Yeah.
So each and every organ, their cancer, characteristic of the cancer developed in each and every organ biologically mostly completely different.
Yeah.
Based on the biological nature of a cancer and based on the pattern of spread, the treatment has been designed. So cancer, if you can actually divide the cancer broadly, it can be divided in two ways. One is a solid, one is a liquid tumor. Liquid tumor means, like in our body, if you can say that there is a bloodstream. Bloodstream, there are mostly the three types of cells, like the red blood cell, white blood cell, and platelets, like that. If number of the red blood cell is increasing or number of the white blood cell is increasing, still we cannot see anything because it is a blood is mostly comprised of the liquid, or it is a water. So the number of cells, if it is increasing, we cannot appreciate any tumor. So that is why this type of cells are, this type of cancers is called the liquid tumors. But in case of the solid tumor, like the breast tumor, like the tumor, like the rectum tumor, brain tumor, like that, the thing is, whenever there will be the cancer tumor development, and this particular tumor, if it is a locally placed or loco-regionally placed, if it is locally placed, most of the time surgery is the primary treatment of choice in many tumors, like the lung tumor or something, and sometimes it is the radiation is the, like the cervix, even if it is a locally or localized disease, radiation is the primary mode of treatment, not the surgery. But in case of the lung tumor, or in case of the stomach tumor, in case of the colon tumor, the surgery is the primary. In case of the larynx or oropharynx or the nasopharynx tumor, radiation is the primary. So some from which form of the local treatment has to be given prior. There is a lot of trial had been based on the treatment guidelines have been designed. Like either treatment like the form of the radiation or in form of the cells. To assist local treatment, the chemotherapy has been given in those scenarios. And most of the time, if the disease is metastatic at the diagnosis, then the most of the treatment bulk will be based on the chemotherapy or system therapy. Now, surgery, if surgery is the primary treatment at particular cancer, then surgery has to be offered. There is no this concept of spreading the disease by surgery. But in case of a disease, most not do the surgery most of the time is not out of the place. In that case, there is no role of surgery at all. But in the mostly locally or localized disease, surgery are the mainstay of the treatment in many tumors, and those tumors surgery has to be done. And in some tumors, the surgery is not the mainstay. Radiation is the mainstay. The radiation has to be done. Radiation thing, we not spread the disease to anywhere, because this is that is called the oncologic surgery. So oncological principles, the surgical principle has to be maintained due to the oncological surgery or oncosurgeries. Now, the difference, some points you can argue that is possible, like in case of a pelvic tumor, like an ovary tumor, the cells are there, they are actually in between the peritoneum. So whenever you are going to get all the tumors out, and you can find there are some sort of the cells deposited in the peritoneum. That is possible, and that will not upstage disease at all. Okay. So that is also not, and that is a very nuanced medical discussion. So that is absolutely not for the normal people to understand this thing. And the last thing is only one, that is also a very nuanced thing. It's called the, in case of certain tumors like testicular tumor. Testicular tumor we cannot see, because in this particular tumor, if you are the biopsy, then the tract will be covered by the tumor. That is the only condition where we do direct rather than biopsy. Other than in all diseases, the biopsy has to be performed prior to the any sort of the oncological treatment decision.
Yes, thank you. Actually, I have seen after when doing the biopsy, it just like when uncontrollable. Thank you for asking me. I'm also over. Thank you.
Thank you, Pradipta, for very useful questions, and Doctor for very useful answers, very educative to us. Any other question, please?
Hello.
Yes.
Can you hear me?
Yes, yes.
A very small humble submission is actually radiation, chemo, and I mean, just many different therapies are there. Oh, which one is least vulnerable? Actually, very much curious to know. Am I audible?
Yeah, you are audible. Actually, I can't exact question. So,
Of the
what
diff-
exactly do you want to mean?
out of the different therapies to treat the cancer patients, which treatment is less painful and less vulnerable to the patients?
So there is it is it is not like that actually. So out of all the treatments means all the patient will not need all the treatment.
Right,
Okay.
right, exactly. But for the treatment of the cancer patients, in oral
About the toxicity of the treatment, right?
oral medication. No, in fact, in terms of the pain and the severe anxiety due to the pain of the patients.
Okay. Actually, if you can say that per se there is very less pain involved in any form of the cancer patient treatment. Specific site related treatment might have pain, like in case of head neck, like if some radiation will be related to the tongue region or the pharynx region, there might be a bit of throat in the radiation. If otherwise there will be no radiation, there will be given this surgery a little bit operative pain. Of the surgery is there might be some post pain. Chemotherapy, therapy, no pain. Some sort of therapy will have a little bit of toxins, like that the blood count. That is why the patient to be patient may get episode fever. Sometimes patient may get admitted for 1 or 2 days to fight that fever, or antibiotics might be needed like that. And sometimes the fall will be there. So
exactly.
Part is the particularly if you are asking about the pain is not a big question in that particular any sort of the cancer treatment. Pain can be there, but that pain is very normal and can be handled with the normal analgesics, normal pain medications. So per se treatment per se pain is not a big issue. But yes, sometimes the cancer in particular part of the body that will stimulate their nerve in that particular part of the body, then it can cause and that is called cancer pain. So cancer pain is very dreaded thing. So we have lot of things, or we have lot of things to do about the cancer pain. Modalities have been tried, lot of patients have been. So pain management very the very tricky situation, but treatment per se the pain is very much, we cannot say like that. Some specific sometimes the post-operative pain may last for 3 to 4 days, sometimes not like that. So this is very subjective.
In fact, in my domain, I have seen 2 cancer patients who could not complete the chemotherapy, and they expired before the completion of the chemotherapy.
Okay.
And the expiry was so painful. I mean, painful not to the teams, but to the patients.
Okay.
So it is really appears unbearable.
You are actually addressing some specific patients. So why this specific patient could not tolerate chemotherapy, or what might be the cause of that pain? We have to assess, or we have to evaluate the medical history. Very difficult to comment because chemotherapy per se usually not causing any pain. But yes, if in certain type of disease, patient might not tolerate chemotherapy. There are incidents of that the patient cannot tolerate the chemotherapy, or their disease burden is that high, and the specific team has been designed. This patient could not tolerate chemotherapy. That the incidents there, but case to case, we can discussing case to case. It is not a common phenomenon. So what are the cases you have said right now? We have to know what is the case, or what is the disease burden, or what is the primary, what is from which organ the cancer has been developed, what are the treatment received by the patient, and what are the regimes has been used, what other treatment has been used. A lot of things have to be studied to get you an idea, to give you an idea about the pain and whatever the treatment related toxicity the patient suffered from. But usually, more patient, whenever has been treated in the early advanced stages. Cancer related treatment related side effects are very minimal. Most of the patients getting treatment without any major side effects. Sometimes if the disease was very high, target therapy, systemic therapy has to be very is very group operation. Then it is there specific substances are there. You have to know which specific disease you are talking about. Otherwise, it's very difficult to answer.
Specific disease means grossly carcinoma, and that what is prostate, and this one, rectum cancer.
Okay, so prostate cancer. So somebody with prostate cancer. So first of all, prostate cancer patient chemotherapy. This is a stage because of the prostate earlier is the radiation and hormone therapy and sometimes surgery. But if patient has been started treatment with the chemotherapy only, that means it is advanced group of patient prostate cancer and mostly stage 4 disease. So, and stage prostate cancer the chance will move. So high prevalence prostate cancer and very much pain cancer. It not the chemotherapy. It is probably it will be of the cancer. And previously there are of cancer in various stages of disease. Most of the time, the cause of the pain is due to the involvement of specific structure by the cancer, like bony structure, like the more neurological structure. If this has been involved, then there is a chances of the cancer pain. So there is a possible that might be a possibility that due to the extensive bone lesion, there will be the pain. That can be the cause of the pain. That is a possibility. But still, that is what I am saying based on a simple information that the patient has got a prostate cancer only and patient has received only chemotherapy. Based on these two information, I am trying to predict this. Then the whole case history has to be evaluated prior to giving specific comment.
Right. Thank you. Thank you very much. Okay.
Yeah.
Dr. Majumder,
Yes.
I am Mr. Tarok Shah.
Okay.
I want to put two questions on varied subjects. Number one is that if a man infected with cancer and it is not identified, suppose lung cancer, lung cancer is not easily identified. Suppose that lung infected cancer people intercourses with a woman, how are the woman is susceptible to cancer?
First of all, cancer is not an infectious disease. So the term the patient is infected with cancer is wrong because cancer is not an infectious disease, it's a non-communicable disease. If somebody is in cancer, he or she, anybody else, or do physical interest to any, so there is no chance transmission of the cancer 1%. That is very clear. So there is no, it's a non-communicable disease.
Achha, number two. Doctor,
Yes. Yes, please go ahead.
Number two. How does a man got infected with skin cancer? Is it from the pollution that we are living in the environment?
Yeah, there are a lot of, not only pollution, there are a lot of genetic mutations are possible. There can be sporadic genetic mutations possible. A lot of radiation-related pollution, or some sort of the environmental pollution can be the cause. Some occupations where the people are using heavy metals or heavy metal industry like that. A lot of cause. Even there are sporadic cases also. So it is very difficult to comment what is the specific cause of the skin cancer. But per se, the skin cancer in our clinical practice, we generally do not see the lot of skin cancer in our clinical practice. It is mostly seen in the western part of the world. In our part of we are still we are tobacco dependencies more.
Is it dependent? Is it dependent on the food habits or other reasons?
Food habits, yes, food habits, whatever the food habits has been found in the literature, I have summarized and told in my slides in a very simpler manner. Yes, whatever I have said, you can follow that. Specific food habit, it is very cancer. We can actually put the food with the diseases, with some sort of mostly the cardiac diseases and hematological diseases like that. Mostly the cardiac diseases. Case of the associated light, excess other associated very light. So it is very wise to that this food. If you are going to avoid cancer, you will be from. There is no such straight answer is possible till date.
Then another question I want to put before you. So lung cancer is a very much symptom with the man with susceptibility to cold. Number one, the second is the whose ESR and TCDC is high. Eosinophilia is high. The lung cancer is that the common phenomenon is common to the susceptibility to the cold and the lung cancer, and that's why lung cancer is detected when the patient goes to advanced stage. How does it can be identified when that goes beyond the control of the treatment?
First of all, if I can your question, saying that most lung cancer are advanced stage, how we can treat this in advanced stage, or we can prevent to present advanced stage like that, right?
Yeah.
Huh?
Yeah.
This is the question. And you have asked compatibility of the cold. I can't get this correctly. If you can reiterate questions for me once.
Doctor, I'm Ratan Chaudhary. My question is that we are generally doing the biopsy for the cancer detection normally.
Okay. Okay.
And but I have the information that in developed countries there or USA, they are now doing it by taking the blood, and then from that blood they are segregate that group, and from that they are identify the cancer, not that biopsy. Is it true?
All it is not for the developed country. It is the practice in our country also, in our hospital. So it every oncologist clinical practice.
So why they are asking the biopsy?
It is not developed country, first of all, not for the developed country. And one, what is the treatment right now in our, whatever the treatment in the developed country, most of the treatment is possible in our countries also, because all the equipments and all the molecules are available in our country. There is nothing initially in 2 to 3 decades we used to say that this drug we bring all like that. Everything available in our for that. Now the what you found the biopsy is possible, but this is not for the treatment. For the treatment, biopsy to be taken tumor after the treatment sometimes years, and it is difficult the rebiopsy. Then we do the biopsy, that is taking a sample and do some molecular marker test by which can have idea about the molecular profiling of the tumor. But doing the molecular profiling of a tumor de novo means treatment. That means that has not received any treatment in any part of the time or any time in their life for cancer is not recommended. Recommended is after recurrence, after reoccurrence, for some profiling to the blood sample that is called the biopsy, and it's standard of care in everywhere right now. So primary treatment should be guided by the primary biopsy.
Okay, thank you.
Dr. Majumder, good afternoon. This is Avijit. I have a question. Actually, I want to know that the cancer is the uncontrolled cell growth or some kind of tumor. For that, actually, our body having some mechanism to resist. So for that, we need to take the treatment, or we can wait for our body to react. Is there any possibility to wait for that body to react?
No, body cannot react. Body cannot react on its own. Body can only react. So that is the thing. That is the concept of the immunotherapy actually. So whenever there is a clinically visible malignant tumor, that means the number of cells are in millions. You have to minimize the number of cells as much as possible by radiation, by surgery, by chemotherapy, whatever form is possible. Then if the whatever form of treatment you are, even if in the localized disease, you are surgically remove the tumor and surrounding area, you have given the radiation to the surrounding area, everything is clear on the CT scan and PET CT scan, everything is clear. Still there will be the cells because that will not be picked up by the normal imaging. And this type of the cells, a very minimal amount of cell that can be taken care of by the body. So body immunity can take in those cells in some cases, and sometimes it might not be. So that is why the cancer will be recurring. So the recurrence of the cancer is due to that. So whatever the number of cells, even if it is very minimized in number, still there is a chance of recurrence of the cancer, even if you have removed everything. So this thing, the recurrence is only due to, even after complete removal of the complete cure of the cancer, even after 5 years, if the cancer cells recurs, that means the body failed to tackle the very minimal left out cells also, which was there even after the extensive treatment the patient has received. But most of the time, body will tackle this type of cells, and then the patient remains cancer free throughout their life. But that will only be possible after maximal eradications of the cell. Maximum eradication of the cell has to be done by surgery, radiation, or chemotherapy, any modality which is possible for this particular stage of the disease.
Dr. Majumder.
Hello?
Yeah,
Hello.
tell me. Yes, I'm listening.
I have another question to put to you, sir.
Okay.
This case has happened to my mother. In the year 1996, my mother had a pain, gallbladder pain. And after USG was done, and it was found some calculi and some lesion was there. Lesion and some calculi were found in his gallbladder, in her gallbladder. And all doctor diagnosed that it is a cancer. But astonishingly, we found, and we did not do any treatment for him. When we heard that she is had been undergoing some cancer, so we did not go for the treatment. And actually, he survived 10 long years.
Okay.
Had she been operated upon, I think we thought that there was some metastasis could have been happened in his body, in his gallbladder and evaporation. But he survived 10 years without any treatment. How was it possible?
So how the diagnosis of gallbladder cancer made?
And it was not.
How was the diagnosis made of a gallbladder cancer?
No. We actually, after that, we did some FNAC. FNAC, and the FNAC could not diagnose the cancer.
So there was no cancer then?
Huh?
You are saying that the FNAC was done and
after 10 years,
so that means there was no cancer.
I am telling you, after 10 years, when some CT scan was done, that it was found that some white spots were going upwards.
Sir, just let me answer this question. First of all,
and he died. And she died. After that, she died.
So first of all, if there is a cancer, that has to be proven by a biopsy. If there is no biopsy available in a very fast hand, that means we cannot comment whether there is a cancer or not, first of all. So if there is a biopsy was done or not, first that is the question. And if the biopsy was not done, in some cases, a very early gallbladder carcinoma, sometimes due to the calculus in the gallbladder, the cholecystectomy, at the process of the cholecystectomy, the sample has been taken out, and on the laboratory, the cholecystectomy specimen, the biopsy, cholecystectomy specimen showed there is a presence of the cancer. By this way, retrospectively, we can comment that there was a gallbladder cancer, because that is not done due to any symptoms. But without any histopathological proof, we can think cancer might be the suspicion might be there, but we cannot say that this patient is suffering from the cancer. So was there any histopathology, that means a tissue diagnosis made that was showing any sort of the gallbladder carcinoma? If it is not showing that then we cannot say that this patient was suffering from cancer or not. Hello.
Hello.
FNAC. Number two, we did not do that biopsy in fear of that it could be metastasis.
No. Gallbladder biopsy is not like that.
Go for the biopsy.
No, gallbladder biopsy is not like that. If there is a calculus present in the gallbladder, then there are certain indication by which the gallbladder has to be removed. Usually, the cholecystectomy, that is called the cholecystectomy. So, with the calculus started gallbladder, sometimes gallbladder has to be removed, and in that gallbladder, the biopsy has to be done. If there was, that is why I am saying, even if you are saying that the FNAC was done, but FNAC was not showing any cancer, that itself proves that there is no proof of any cancer in this patient. If this patient was suffering from cancer, then it was not possible to get cured without any treatment. Patient didn't have any cancer because there was no proof of cancer.
Sir, one last question from my side. Can you give some light about the treatment of cancer with stem cells?
Stem cell?
Yeah. Is there any therapy to cure the cancer?
Stem cell transplant. Stem cell transplant is usually a hematology domain. I am doing the cancer therapy in the solid oncology, so solid tumor group. Solid tumor, mostly the stem cell transplant is not a part. But yes, so autologous and allogeneic stem cell transplant has been a part of the hematological. There is the liquid tumors, what I have said, like the ALL, CML, multiple myeloma, this type of the liquid Hodgkin lymphoma, non-Hodgkin lymphoma. So this is a part of the treatment, but most of the time, firstly the patient has to be treated by the systemic therapy, the chemotherapy, and in a recurrence setting, the stem cell transplant or stem cell harvest is the option in most of the time. So that part will be dealt by the hemato-oncologist. So we are not doing this part of the treatment. So stem cell transplant is a domain of a hemato-oncology.
Thank you, sir.
Thank you.
Okay.
Dr. Majumder,
thank you.
we have a request that we are transforming your deliberation in article format.
Okay.
For printing in our journal, which is a 70 years old
Sure.
technical journal we publish every month.
Sure.
We have to print that with your permission. And before that, after final article format came out, then we will send it back to you for just going through it and give it your signal so that we can print it.
Or we can send you the transmitted copy. You can make it an article and then you can send it back to us.
If you can make it from your side and send it to me for the any just proofreading or type of thing, I'll be happy with that.
Yeah, it is better. It will save your time. And we have a software, we can do it.
Okay.
Finally, you have to check it.
Sure. Thank you.
Now we are at the end of the program today. We have Mr. Abhijit Das, who is the Secretary of Alumni Association, Government College of Engineering and Electrical Technology. I request Mr. Das to give vote of thanks, please. Before that, I want to show you the memento you want to send to your home as a token of honor to you for today's deliberation. So please look into it. And we'll wait there. That's it. I am physical language. Video down karo. Video down karo. Okay.
Okay. Thank you. Thank you very much. Okay.
So this is the
Okay, I can see it. Yes, yes.
yeah.
Yeah. Thank you very much. Thank you very much.
So over to Abhijit, please.
Good afternoon, everyone. Hope you will have a great session on awareness of cancer. And the cancer is a high concern issue in present day. And we have cleared so many doubts that in our mind through question answer session. And for this great session, I would like to thank Dr. Dipanjan Majumder, the consultant radiology oncology, radiation oncology, Narayana Cancer Center. And we also thank Mr. Samrat Pal for coordinating this webinar. And we thank the General Secretary of ILTA, Mr. Sushant Mullik, the HRD Committee, Executive Committee of ILTA, GCLT, the Principal of GCLT, Dr. Sanjay Chakraborty, and administration for their initiation and association to make this event successful. And overall, we are thankful to all the respected audience for their precious time to spread the message about the awareness and prevention of cancer. So with this, we are concluding today's program and wishing you all a great day ahead. Thank you.